Dentist.
The dentist examined her teeth carefully. The dentist examined her teeth carefully. She has an appointment with the dentist tomorrow. She has an appointment with the dentist tomorrow. The dentist recommended regular checkups. The dentist recommended regular checkups.
Dental office.
The dental office is located downtown. The dental office is located downtown. They're going to the dental office for a cleaning. They're going to the dental office for a cleaning. The dental office has modern equipment. The dental office has modern equipment.
Dental clinic.
The dental clinic offers various services. The dental clinic offers various services. They're building a new dental clinic in the neighborhood. They're building a new dental clinic in the neighborhood. The dental clinic is open Monday through Friday. The dental clinic is open Monday through Friday.
Appointment.
She made an appointment with the dentist. She made an appointment with the dentist. The appointment is scheduled for next week. The appointment is scheduled for next week. They need to cancel their appointment. They need to cancel their appointment.
To make an appointment.
She needs to make an appointment for a checkup. She needs to make an appointment for a checkup. They made an appointment by phone. They made an appointment by phone. He's going to make an appointment online. He's going to make an appointment online.
To schedule an appointment.
They're going to schedule an appointment for next month. They're going to schedule an appointment for next month. The receptionist scheduled an appointment for tomorrow. The receptionist scheduled an appointment for tomorrow. They're scheduling an appointment for a cleaning. They're scheduling an appointment for a cleaning.
To cancel an appointment.
She had to cancel her appointment because she was sick. She had to cancel her appointment because she was sick. They cancelled their appointment at the last minute. They cancelled their appointment at the last minute. He's going to cancel his appointment and reschedule. He's going to cancel his appointment and reschedule.
To reschedule.
She needs to reschedule her dental appointment. She needs to reschedule her dental appointment. They rescheduled the appointment for next week. They rescheduled the appointment for next week. He's going to reschedule because of a conflict. He's going to reschedule because of a conflict.
To arrive.
She arrived at the dental office on time. She arrived at the dental office on time. They arrived early for their appointment. They arrived early for their appointment. He's going to arrive at 2 p.m. for his appointment. He's going to arrive at 2 p.m. for his appointment.
To wait.
She's waiting in the reception area. She's waiting in the reception area. They had to wait 15 minutes before being seen. They had to wait 15 minutes before being seen. He's waiting for the dentist to call his name. He's waiting for the dentist to call his name.
To check in.
She needs to check in at the reception desk. She needs to check in at the reception desk. They checked in when they arrived. They checked in when they arrived. He's going to check in at the front desk. He's going to check in at the front desk.
Receptionist.
The receptionist greeted them warmly. The receptionist greeted them warmly. She spoke with the receptionist about her appointment. She spoke with the receptionist about her appointment. The receptionist confirmed their appointment time. The receptionist confirmed their appointment time.
Waiting room.
The waiting room has comfortable chairs and magazines. The waiting room has comfortable chairs and magazines. They sat in the waiting room until called. They sat in the waiting room until called. The waiting room is clean and well lit. The waiting room is clean and well lit.
To call.
The dental assistant called her name. The dental assistant called her name. They called the next patient. They called the next patient. The dentist will call you when ready. The dentist will call you when ready.
To go in.
She went into the treatment room. She went into the treatment room. They went in when the dentist called them. They went in when the dentist called them. He's going to go in for his examination. He's going to go in for his examination.
Treatment room.
The treatment room has a dental chair and equipment. The treatment room has a dental chair and equipment. They're in the treatment room waiting for the dentist. They're in the treatment room waiting for the dentist. The treatment room is equipped with modern technology. The treatment room is equipped with modern technology.
Dental chair.
She sat in the dental chair for her examination. She sat in the dental chair for her examination. The dental chair can recline for comfort. The dental chair can recline for comfort. They adjusted the dental chair to the right position. They adjusted the dental chair to the right position.
To sit down.
The dentist asked her to sit down in the chair. The dentist asked her to sit down in the chair. They sat down and waited for the examination. They sat down and waited for the examination. He's going to sit down in the dental chair. He's going to sit down in the dental chair.
To lie down.
The dentist asked her to lie down in the chair. The dentist asked her to lie down in the chair. They lay down for the dental procedure. They lay down for the dental procedure. He's going to lie down so the dentist can work. He's going to lie down so the dentist can work.
To open one's mouth.
The dentist asked her to open her mouth wide. The dentist asked her to open her mouth wide. They opened their mouths for the examination. They opened their mouths for the examination. He needs to open his mouth so the dentist can see. He needs to open his mouth so the dentist can see.
To close one's mouth.
The dentist asked her to close her mouth for a moment. The dentist asked her to close her mouth for a moment. They closed their mouths when asked. They closed their mouths when asked. He can close his mouth now and rest. He can close his mouth now and rest.
To examine.
The dentist is going to examine her teeth. The dentist is going to examine her teeth. They examined the patient's mouth carefully. They examined the patient's mouth carefully. He's examining the X-rays. He's examining the X-rays.
Examination.
The dental examination took about 30 minutes. The dental examination took about 30 minutes. They're having a routine examination today. They're having a routine examination today. The examination revealed several cavities. The examination revealed several cavities.
Checkup.
She's going for a regular checkup. She's going for a regular checkup. They recommend a checkup every 6 months. They recommend a checkup every 6 months. The checkup showed her teeth are healthy. The checkup showed her teeth are healthy.
Tooth.
She has a cavity in her tooth. She has a cavity in her tooth. The tooth needs to be filled. The tooth needs to be filled. They're cleaning all her teeth. They're cleaning all her teeth.
Teeth.
She brushes her teeth twice a day. She brushes her teeth twice a day. The dentist checked all her teeth. The dentist checked all her teeth. They're cleaning her teeth professionally. They're cleaning her teeth professionally.
Toothache.
She has a terrible toothache. She has a terrible toothache. The toothache kept her awake all night. The toothache kept her awake all night. They're treating her toothache with pain medication. They're treating her toothache with pain medication.
To hurt.
Her tooth hurts when she eats. Her tooth hurts when she eats. The tooth hurt so much she couldn't sleep. The tooth hurt so much she couldn't sleep. It hurts when the dentist touches that tooth. It hurts when the dentist touches that tooth.
Pain.
She's experiencing pain in her tooth. She's experiencing pain in her tooth. The pain is getting worse. The pain is getting worse. They're trying to relieve the pain. They're trying to relieve the pain.
To feel pain.
She feels pain when biting down. She feels pain when biting down. They felt pain during the procedure. They felt pain during the procedure. He's going to feel pain if the cavity isn't treated. He's going to feel pain if the cavity isn't treated.
Cavity.
The dentist found a cavity in her tooth. The dentist found a cavity in her tooth. They need to fill the cavity. They need to fill the cavity. The cavity is getting larger. The cavity is getting larger.
To fill.
The dentist is going to fill the cavity. The dentist is going to fill the cavity. They filled the tooth with a white filling. They filled the tooth with a white filling. He's going to fill all the cavities today. He's going to fill all the cavities today.
Filling.
She has a filling in her back tooth. She has a filling in her back tooth. The filling needs to be replaced. The filling needs to be replaced. They're putting in a new filling. They're putting in a new filling.
To clean.
The hygienist is going to clean her teeth. The hygienist is going to clean her teeth. They cleaned his teeth professionally. They cleaned his teeth professionally. She's going to clean all the plaque. She's going to clean all the plaque.
Cleaning.
She's having a dental cleaning today. She's having a dental cleaning today. The cleaning removes plaque and tartar. The cleaning removes plaque and tartar. They recommend a cleaning every 6 months. They recommend a cleaning every 6 months.
Dental hygienist.
The dental hygienist cleaned her teeth. The dental hygienist cleaned her teeth. They're seeing the dental hygienist first. They're seeing the dental hygienist first. The dental hygienist showed her how to floss properly. The dental hygienist showed her how to floss properly.
Plaque.
The plaque needs to be removed regularly. The plaque needs to be removed regularly. They're removing the plaque from her teeth. They're removing the plaque from her teeth. The plaque buildup can cause cavities. The plaque buildup can cause cavities.
Tartar.
The tartar needs to be scraped off. The tartar needs to be scraped off. They're removing the tartar buildup. They're removing the tartar buildup. The tartar is hard and difficult to remove. The tartar is hard and difficult to remove.
To brush.
She brushes her teeth twice a day. She brushes her teeth twice a day. They brushed their teeth before the appointment. They brushed their teeth before the appointment. He's going to brush his teeth more carefully. He's going to brush his teeth more carefully.
Toothbrush.
She needs a new toothbrush. She needs a new toothbrush. The toothbrush should be replaced every 3 months. The toothbrush should be replaced every 3 months. They're recommending an electric toothbrush. They're recommending an electric toothbrush.
Toothpaste.
She uses fluoride toothpaste. She uses fluoride toothpaste. The toothpaste helps prevent cavities. The toothpaste helps prevent cavities. They're recommending a specific toothpaste for sensitive teeth. They're recommending a specific toothpaste for sensitive teeth.
To floss.
She flosses her teeth every night. She flosses her teeth every night. They flossed before the appointment. They flossed before the appointment. He's going to floss more regularly. He's going to floss more regularly.
Dental floss.
She uses dental floss every day. She uses dental floss every day. The dental floss removes food between teeth. The dental floss removes food between teeth. They're recommending waxed dental floss. They're recommending waxed dental floss.
To rinse.
She rinses her mouth with water after brushing. She rinses her mouth with water after brushing. They rinsed with mouthwash. They rinsed with mouthwash. He's going to rinse after the procedure. He's going to rinse after the procedure.
Mouthwash.
She uses mouthwash after brushing. She uses mouthwash after brushing. The mouthwash helps kill bacteria. The mouthwash helps kill bacteria. They're recommending an antibacterial mouthwash. They're recommending an antibacterial mouthwash.
X-ray.
The dentist took an X-ray of her teeth. The dentist took an X-ray of her teeth. They're looking at the X-rays to check for problems. They're looking at the X-rays to check for problems. The X-ray showed a cavity between two teeth. The X-ray showed a cavity between two teeth.
To take an X-ray.
The dentist is going to take an X-ray. The dentist is going to take an X-ray. They took X-rays to see what's wrong. They took X-rays to see what's wrong. He's going to take an X-ray before the procedure. He's going to take an X-ray before the procedure.
Root canal.
She needs a root canal on her molar. She needs a root canal on her molar. The root canal will save the tooth. The root canal will save the tooth. They're performing a root canal today. They're performing a root canal today.
To do a root canal.
The dentist is going to do a root canal. The dentist is going to do a root canal. They did a root canal to save the tooth. They did a root canal to save the tooth. He's going to do a root canal next week. He's going to do a root canal next week.
Extraction.
She needs an extraction of her wisdom tooth. She needs an extraction of her wisdom tooth. The extraction was quick and painless. The extraction was quick and painless. They're performing an extraction today. They're performing an extraction today.
To extract.
The dentist is going to extract the tooth. The dentist is going to extract the tooth. They extracted the damaged tooth. They extracted the damaged tooth. He's going to extract the wisdom tooth. He's going to extract the wisdom tooth.
To pull out.
The dentist needs to pull out the tooth. The dentist needs to pull out the tooth. They pulled out the tooth that was causing pain. They pulled out the tooth that was causing pain. He's going to pull out the infected tooth. He's going to pull out the infected tooth.
Wisdom tooth.
She's having her wisdom tooth removed. She's having her wisdom tooth removed. The wisdom tooth is causing problems. The wisdom tooth is causing problems. They're extracting all 4 wisdom teeth. They're extracting all 4 wisdom teeth.
Crown.
She needs a crown on her damaged tooth. She needs a crown on her damaged tooth. The crown will protect the tooth. The crown will protect the tooth. They're putting a crown on the tooth today. They're putting a crown on the tooth today.
To put on a crown.
The dentist is going to put on a crown. The dentist is going to put on a crown. They put on a crown to protect the tooth. They put on a crown to protect the tooth. He's going to put on a crown next week. He's going to put on a crown next week.
Bridge.
She's getting a bridge to replace missing teeth. She's getting a bridge to replace missing teeth. The bridge will fill the gap in her smile. The bridge will fill the gap in her smile. They're installing a bridge next month. They're installing a bridge next month.
Denture.
She has a denture for her missing teeth. She has a denture for her missing teeth. The denture needs to be adjusted. The denture needs to be adjusted. They're fitting her for new dentures. They're fitting her for new dentures.
Implant.
She's getting a dental implant to replace a missing tooth. She's getting a dental implant to replace a missing tooth. The implant will look and feel like a real tooth. The implant will look and feel like a real tooth. They're placing the implant today. They're placing the implant today.
Braces.
She's getting braces to straighten her teeth. She's getting braces to straighten her teeth. The braces will be on for 2 years. The braces will be on for 2 years. They're adjusting her braces today. They're adjusting her braces today.
To straighten.
The braces will straighten her teeth. The braces will straighten her teeth. They're straightening his teeth with braces. They're straightening his teeth with braces. He's going to straighten his teeth with orthodontic. He's going to straighten his teeth with orthodontic.
Orthodontist.
She's seeing an orthodontist for braces. She's seeing an orthodontist for braces. The orthodontist specializes in straightening teeth. The orthodontist specializes in straightening teeth. They're consulting with an orthodontist about treatment. They're consulting with an orthodontist about treatment.
Anesthesia.
The dentist will use local anesthesia for the procedure. The dentist will use local anesthesia for the procedure. The anesthesia numbs the area. The anesthesia numbs the area. They're administering anesthesia before the extraction. They're administering anesthesia before the extraction.
To numb.
The dentist will numb the area before the procedure. The dentist will numb the area before the procedure. They numbed her gums with local anesthesia. They numbed her gums with local anesthesia. He's going to numb the tooth before filling it. He's going to numb the tooth before filling it.
Numb.
Her mouth feels numb after the anesthesia. Her mouth feels numb after the anesthesia. The area is still numb from the injection. The area is still numb from the injection. They feel numb in their lip and cheek. They feel numb in their lip and cheek.
Injection.
The dentist gave her an injection to numb the area. The dentist gave her an injection to numb the area. The injection was quick and relatively painless. The injection was quick and relatively painless. They're giving an injection before the procedure. They're giving an injection before the procedure.
To inject.
The dentist is going to inject the anesthesia. The dentist is going to inject the anesthesia. They injected the local anesthetic into her gum. They injected the local anesthetic into her gum. He's going to inject the numbing medication. He's going to inject the numbing medication.
Drill.
The dentist used a drill to remove the decay. The dentist used a drill to remove the decay. The drill makes a loud noise. The drill makes a loud noise. They're using the drill to prepare the tooth for a filling. They're using the drill to prepare the tooth for a filling.
To drill.
The dentist is going to drill the tooth. The dentist is going to drill the tooth. They drilled the cavity to clean it out. They drilled the cavity to clean it out. He's going to drill before putting in the filling. He's going to drill before putting in the filling.
Gum.
Her gums are bleeding when she brushes. Her gums are bleeding when she brushes. The gum is swollen and painful. The gum is swollen and painful. They're checking her gums for signs of disease. They're checking her gums for signs of disease.
Gums.
She has healthy gums. She has healthy gums. The gums need to be treated for inflammation. The gums need to be treated for inflammation. They're examining her gums during the checkup. They're examining her gums during the checkup.
Gum disease.
She has early signs of gum disease. She has early signs of gum disease. The gum disease needs to be treated. The gum disease needs to be treated. They're treating her gum disease with deep cleaning. They're treating her gum disease with deep cleaning.
Bleeding.
Her gums are bleeding when she brushes. Her gums are bleeding when she brushes. The bleeding stopped after the procedure. The bleeding stopped after the procedure. They're concerned about the bleeding gums. They're concerned about the bleeding gums.
To bleed.
Her gums bleed when she flosses. Her gums bleed when she flosses. The tooth bled after the extraction. The tooth bled after the extraction. It's normal for gums to bleed a little after cleaning. It's normal for gums to bleed a little after cleaning.
Swollen.
Her gum is swollen and painful. Her gum is swollen and painful. The swollen area needs treatment. The swollen area needs treatment. They're treating the swollen gums. They're treating the swollen gums.
Sensitive.
Her teeth are sensitive to cold. Her teeth are sensitive to cold. The sensitive tooth needs special care. The sensitive tooth needs special care. They're using toothpaste for sensitive teeth. They're using toothpaste for sensitive teeth.
Sensitivity.
She's experiencing sensitivity in her teeth. She's experiencing sensitivity in her teeth. The sensitivity is caused by exposed roots. The sensitivity is caused by exposed roots. They're treating the sensitivity with special toothpaste. They're treating the sensitivity with special toothpaste.
To recommend.
The dentist recommends brushing twice a day. The dentist recommends brushing twice a day. They recommended flossing daily. They recommended flossing daily. He's going to recommend a root canal. He's going to recommend a root canal.
Recommendation.
The dentist's recommendation is to floss more often. The dentist's recommendation is to floss more often. They're following the recommendations for oral care. They're following the recommendations for oral care. The recommendation is to come back in 6 months. The recommendation is to come back in 6 months.
To advise.
The dentist advised her to use a softer toothbrush. The dentist advised her to use a softer toothbrush. They advised him to avoid sugary foods. They advised him to avoid sugary foods. He's going to advise her on proper oral hygiene. He's going to advise her on proper oral hygiene.
Advice.
The dentist gave her good advice about oral care. The dentist gave her good advice about oral care. They're following the advice to improve their dental health. They're following the advice to improve their dental health. The advice is to brush for at least 2 minutes. The advice is to brush for at least 2 minutes.
To tell.
The dentist told her to come back in 6 months. The dentist told her to come back in 6 months. They told him about the cavity that needs filling. They told him about the cavity that needs filling. He's going to tell her the results of the examination. He's going to tell her the results of the examination.
To explain.
The dentist explained the procedure to her. The dentist explained the procedure to her. They explained why the tooth needs to be extracted. They explained why the tooth needs to be extracted. He's going to explain the treatment options. He's going to explain the treatment options.
To show.
The dentist showed her the X-ray. The dentist showed her the X-ray. They showed him how to brush properly. They showed him how to brush properly. He's going to show her the cavity in the mirror. He's going to show her the cavity in the mirror.
To ask.
She asked the dentist about the procedure. She asked the dentist about the procedure. They asked if it would hurt. They asked if it would hurt. He's going to ask about the cost of treatment. He's going to ask about the cost of treatment.
To answer.
The dentist answered all her questions. The dentist answered all her questions. They answered his concerns about the procedure. They answered his concerns about the procedure. He's going to answer any questions she has. He's going to answer any questions she has.
Question.
She has a question about the treatment. She has a question about the treatment. The dentist answered all her questions. The dentist answered all her questions. They're asking questions about oral hygiene. They're asking questions about oral hygiene.
To understand.
She understands the importance of regular checkups. She understands the importance of regular checkups. They understood the dentist's instructions. They understood the dentist's instructions. He's going to make sure she understands the procedure. He's going to make sure she understands the procedure.
To follow.
She needs to follow the dentist's instructions. She needs to follow the dentist's instructions. They're following the recommended oral care routine. They're following the recommended oral care routine. He's going to follow the treatment plan. He's going to follow the treatment plan.
Instruction.
The dentist gave her instructions for after the procedure. The dentist gave her instructions for after the procedure. They're following the instructions carefully. They're following the instructions carefully. The instructions are to avoid hard foods for a few days. The instructions are to avoid hard foods for a few days.
To pay.
She needs to pay for the dental treatment. She needs to pay for the dental treatment. They paid at the reception desk. They paid at the reception desk. He's going to pay with his insurance. He's going to pay with his insurance.
Payment.
The payment can be made by cash or card. The payment can be made by cash or card. They made the payment after the appointment. They made the payment after the appointment. The payment is due at the time of service. The payment is due at the time of service.
Cost.
The cost of the treatment is reasonable. The cost of the treatment is reasonable. They asked about the cost before the procedure. They asked about the cost before the procedure. The cost will be covered by insurance. The cost will be covered by insurance.
Insurance.
Her dental insurance covers most procedures. Her dental insurance covers most procedures. They're checking if their insurance covers the treatment. They're checking if their insurance covers the treatment. The insurance will pay for part of the cost. The insurance will pay for part of the cost.
To leave.
She's going to leave after the appointment. She's going to leave after the appointment. They left the dental office feeling relieved. They left the dental office feeling relieved. He's going to leave once the procedure is finished. He's going to leave once the procedure is finished.
To come back.
The dentist asked her to come back in 6 months. The dentist asked her to come back in 6 months. They need to come back for a follow-up appointment. They need to come back for a follow-up appointment. He's going to come back next week for the crown. He's going to come back next week for the crown.
Follow up.
She has a follow-up appointment next week. She has a follow-up appointment next week. The follow-up is to check how the treatment is going. The follow-up is to check how the treatment is going. They're scheduling a follow-up visit. They're scheduling a follow-up visit.
Healthy.
Her teeth are healthy and strong. Her teeth are healthy and strong. The healthy gums show no signs of disease. The healthy gums show no signs of disease. They're maintaining healthy oral hygiene habits. They're maintaining healthy oral hygiene habits.
Unhealthy.
The unhealthy tooth needs treatment. The unhealthy tooth needs treatment. They're treating the unhealthy gums. They're treating the unhealthy gums. The unhealthy condition requires immediate attention. The unhealthy condition requires immediate attention.
Good.
She has good oral hygiene habits. She has good oral hygiene habits. The good news is that there are no cavities. The good news is that there are no cavities. They're in good dental health. They're in good dental health.
Bad.
She has bad tooth decay. She has bad tooth decay. The bad tooth needs to be extracted. The bad tooth needs to be extracted. They're treating the bad condition. They're treating the bad condition.
Regular.
She has regular dental checkups. She has regular dental checkups. The regular cleaning keeps her teeth healthy. The regular cleaning keeps her teeth healthy. They're maintaining regular oral care. They're maintaining regular oral care.
Routine.
She's having a routine checkup. She's having a routine checkup. The routine cleaning is quick and painless. The routine cleaning is quick and painless. They're performing a routine examination. They're performing a routine examination.
Emergency.
She has a dental emergency and needs immediate care. She has a dental emergency and needs immediate care. The emergency appointment was scheduled right away. The emergency appointment was scheduled right away. They're treating the emergency case today. They're treating the emergency case today.
Urgent.
The tooth pain is urgent and needs immediate attention. The tooth pain is urgent and needs immediate attention. They're treating the urgent dental problem. They're treating the urgent dental problem. The urgent care is available 24 hours a day. The urgent care is available 24 hours a day.
Preventive.
She's having preventive dental care. She's having preventive dental care. The preventive treatment helps avoid problems. The preventive treatment helps avoid problems. They're focusing on preventive measures. They're focusing on preventive measures.
To prevent.
Regular brushing prevents cavities. Regular brushing prevents cavities. They're trying to prevent gum disease. They're trying to prevent gum disease. Flossing helps prevent problems between teeth. Flossing helps prevent problems between teeth.
Prevention.
Prevention is better than treatment. Prevention is better than treatment. They're focusing on prevention of dental problems. They're focusing on prevention of dental problems. The prevention program includes regular checkups. The prevention program includes regular checkups.
Treatment.
She's receiving treatment for her cavities. She's receiving treatment for her cavities. The treatment will take several visits. The treatment will take several visits. They're discussing the treatment options. They're discussing the treatment options.
To treat.
The dentist is going to treat the cavity. The dentist is going to treat the cavity. They treated her gum disease successfully. They treated her gum disease successfully. He's going to treat the infection. He's going to treat the infection.
Care.
She takes good care of her teeth. She takes good care of her teeth. The dental care is excellent at this clinic. The dental care is excellent at this clinic. They're providing quality care for all patients. They're providing quality care for all patients.
To pull out.
She needs to take care of her teeth better. She needs to take care of her teeth better. They're learning how to take care of their oral health. They're learning how to take care of their oral health. He's going to take care of the problem immediately. He's going to take care of the problem immediately.
Oral hygiene.
Good oral hygiene prevents dental problems. Good oral hygiene prevents dental problems. They're teaching proper oral hygiene techniques. They're teaching proper oral hygiene techniques. The oral hygiene routine includes brushing and flossing. The oral hygiene routine includes brushing and flossing.
Oral health.
Her oral health is excellent. Her oral health is excellent. They're improving their oral health with better habits. They're improving their oral health with better habits. The oral health checkup showed no problems. The oral health checkup showed no problems.
Smile.
She has a beautiful smile. She has a beautiful smile. The braces will improve her smile. The braces will improve her smile. They're working to restore her smile. They're working to restore her smile.
To smile.
She smiled after the successful treatment. She smiled after the successful treatment. They smiled with confidence after getting their teeth cleaned. They smiled with confidence after getting their teeth cleaned. He's going to smile more after the braces come off. He's going to smile more after the braces come off.
Bonus examples.
She's going to go to the dentist tomorrow. She's going to go to the dentist tomorrow. They went to the dental office for a checkup. They went to the dental office for a checkup. He's going to go for his regular cleaning. He's going to go for his regular cleaning. She's going to come to the dental clinic next week. She's going to come to the dental clinic next week. They came early for their appointment. They came early for their appointment. He's going to come back in 6 months. He's going to come back in 6 months. She's going to see the dentist today. She's going to see the dentist today. They saw the dentist for a toothache. They saw the dentist for a toothache. He's going to see a specialist. He's going to see a specialist. She's going to visit the dentist regularly. She's going to visit the dentist regularly. They visited the dental office last month. They visited the dental office last month. He's going to visit for a routine checkup. He's going to visit for a routine checkup. She needs to see the dentist. She needs to see the dentist. They need a dental cleaning. They need a dental cleaning. He needs treatment for his cavity. He needs treatment for his cavity. She wants to have her teeth cleaned. She wants to have her teeth cleaned. They want to schedule an appointment. They want to schedule an appointment. He wants to improve his oral health. He wants to improve his oral health. She has an appointment tomorrow. She has an appointment tomorrow. They have a toothache. They have a toothache. He has healthy teeth. He has healthy teeth. She's going to get a dental cleaning. She's going to get a dental cleaning. They got their teeth examined. They got their teeth examined. He's going to get a filling. He's going to get a filling. The dentist is going to take an X-ray. The dentist is going to take an X-ray. They took X-rays of her teeth. They took X-rays of her teeth. He's going to take pain medication. He's going to take pain medication. The dentist will give her an injection. The dentist will give her an injection. They gave him instructions for after the procedure. They gave him instructions for after the procedure. He's going to give her advice about oral care. He's going to give her advice about oral care. She's going to receive treatment today. She's going to receive treatment today. They received excellent dental care. They received excellent dental care. He's going to receive a cleaning. He's going to receive a cleaning. The dentist is going to do a root canal. The dentist is going to do a root canal. They did a thorough examination. They did a thorough examination. He's going to do the cleaning today. He's going to do the cleaning today. She needs to make an appointment. She needs to make an appointment. They made a follow-up appointment. They made a follow-up appointment. He's going to make a phone call to schedule. He's going to make a phone call to schedule. She's going to call the dental office. She's going to call the dental office. They called to cancel their appointment. They called to cancel their appointment. He's going to call to reschedule. He's going to call to reschedule. She's going to phone the dentist's office. She's going to phone the dentist's office. They phoned to make an appointment. They phoned to make an appointment. He's going to phone to confirm the time. He's going to phone to confirm the time. She's going to book an appointment online. She's going to book an appointment online. They booked their appointment for next week. They booked their appointment for next week. He's going to book a time slot. He's going to book a time slot. She needs to confirm her appointment. She needs to confirm her appointment. They confirmed the appointment by phone. They confirmed the appointment by phone. He's going to confirm the date and time. He's going to confirm the date and time. The dentist is going to check her teeth. The dentist is going to check her teeth. They checked the X-rays carefully. They checked the X-rays carefully. He's going to check for any problems. He's going to check for any problems. The dentist is going to look at her teeth. The dentist is going to look at her teeth. They looked at the X-rays together. They looked at the X-rays together. He's going to look at the cavity. He's going to look at the cavity. The dentist found a cavity. The dentist found a cavity. They found several problems during the examination. They found several problems during the examination. He's going to find the source of the pain. He's going to find the source of the pain. The dentist discovered early signs of gum disease. The dentist discovered early signs of gum disease. They discovered the problem during the X-ray. They discovered the problem during the X-ray. He's going to discover what's causing the sensitivity. He's going to discover what's causing the sensitivity. She noticed her tooth was sensitive. She noticed her tooth was sensitive. They noticed bleeding when brushing. They noticed bleeding when brushing. He's going to notice the improvement after treatment. He's going to notice the improvement after treatment. She feels pain in her tooth. She feels pain in her tooth. They felt better after the treatment. They felt better after the treatment. He's going to feel numb after the injection. He's going to feel numb after the injection. The dentist is going to touch the tooth gently. The dentist is going to touch the tooth gently. They touched the sensitive area carefully. They touched the sensitive area carefully. He's going to touch the gum to check for swelling. He's going to touch the gum to check for swelling. The dentist is going to work on her tooth. The dentist is going to work on her tooth. They worked on the cavity for 30 minutes. They worked on the cavity for 30 minutes. He's going to work on the filling today. He's going to work on the filling today. The dentist is going to fix the cavity. The dentist is going to fix the cavity. They fixed the broken filling. They fixed the broken filling. He's going to fix the problem today. He's going to fix the problem today. The dentist is going to repair the damaged tooth. The dentist is going to repair the damaged tooth. They repaired the crown. They repaired the crown. He's going to repair the bridge. He's going to repair the bridge. The dentist is going to remove the plaque. The dentist is going to remove the plaque. They removed the damaged tooth. They removed the damaged tooth. He's going to remove the old filling. He's going to remove the old filling. The dentist is going to put in a new filling. The dentist is going to put in a new filling. They put in a crown on the tooth. They put in a crown on the tooth. He's going to put in the implant next month. He's going to put in the implant next month. The dentist is going to place a filling. The dentist is going to place a filling. They placed the crown carefully. They placed the crown carefully. He's going to place the implant today. He's going to place the implant today. The dentist is going to apply the anesthesia. The dentist is going to apply the anesthesia. They applied fluoride to her teeth. They applied fluoride to her teeth. He's going to apply a protective coating. He's going to apply a protective coating. The dentist will use a drill to clean the cavity. The dentist will use a drill to clean the cavity. They used local anesthesia for the procedure. They used local anesthesia for the procedure. He's going to use modern equipment. He's going to use modern equipment. The dentist will help her with the pain. The dentist will help her with the pain. They helped him improve his oral hygiene. They helped him improve his oral hygiene. He's going to help her understand the procedure. He's going to help her understand the procedure. The dental assistant will assist the dentist. The dental assistant will assist the dentist. They assisted during the procedure. They assisted during the procedure. He's going to assist with the cleaning. He's going to assist with the cleaning. The dentist is going to prepare the tooth for a filling. The dentist is going to prepare the tooth for a filling. They prepared the area before the procedure. They prepared the area before the procedure. He's going to prepare the patient for treatment. He's going to prepare the patient for treatment. The dentist is going to start the procedure. The dentist is going to start the procedure. They started the cleaning at 2 p.m. They started the cleaning at 2 p.m. He's going to start with an examination. He's going to start with an examination. The dentist is going to begin the treatment. The dentist is going to begin the treatment. They began the procedure after the anesthesia took effect. They began the procedure after the anesthesia took effect. He's going to begin with a thorough examination. He's going to begin with a thorough examination. The dentist will continue the treatment next week. The dentist will continue the treatment next week. They continued the procedure after a short break. They continued the procedure after a short break. He's going to continue with the cleaning. He's going to continue with the cleaning. The dentist is going to finish the procedure soon. The dentist is going to finish the procedure soon. They finished the cleaning in 30 minutes. They finished the cleaning in 30 minutes. He's going to finish the filling today. He's going to finish the filling today. The dentist will complete the treatment in 2 visits. The dentist will complete the treatment in 2 visits. They completed the root canal successfully. They completed the root canal successfully. He's going to complete the procedure today. He's going to complete the procedure today. The dentist had to stop because of bleeding. The dentist had to stop because of bleeding. They stopped the procedure when she felt pain. They stopped the procedure when she felt pain. He's going to stop if there's any problem. He's going to stop if there's any problem. She needs to wait for the anesthesia to work. She needs to wait for the anesthesia to work. They waited in the waiting room. They waited in the waiting room. He's going to wait for the numbness to wear off. He's going to wait for the numbness to wear off. She needs to rest after the procedure. She needs to rest after the procedure. They rested for a few minutes between procedures. They rested for a few minutes between procedures. He's going to rest his jaw after the treatment. He's going to rest his jaw after the treatment. She needs to relax during the procedure. She needs to relax during the procedure. They relaxed in the dental chair. They relaxed in the dental chair. He's going to relax to make it easier. He's going to relax to make it easier. She doesn't need to worry about the procedure. She doesn't need to worry about the procedure. They worried about the cost of treatment. They worried about the cost of treatment. He's going to worry less after talking to the dentist. He's going to worry less after talking to the dentist. She's afraid of the drill. She's afraid of the drill. They were afraid of the injection. They were afraid of the injection. He's going to be less afraid after the first visit. He's going to be less afraid after the first visit. She's nervous about the procedure. She's nervous about the procedure. They were nervous before the appointment. They were nervous before the appointment. He's going to be less nervous next time. He's going to be less nervous next time. She tried to be calm during the procedure. She tried to be calm during the procedure. They were calm and relaxed. They were calm and relaxed. He's going to be calm with the dentist's help. He's going to be calm with the dentist's help. She feels comfortable with this dentist. She feels comfortable with this dentist. They felt comfortable in the dental chair. They felt comfortable in the dental chair. He's going to feel comfortable after getting to know the staff. He's going to feel comfortable after getting to know the staff. She trusts her dentist completely. She trusts her dentist completely. They trusted the dentist's recommendations. They trusted the dentist's recommendations. He's going to trust the professional advice. He's going to trust the professional advice. She believes the treatment will help. She believes the treatment will help. They believed the dentist's explanation. They believed the dentist's explanation. He's going to believe in the treatment plan. He's going to believe in the treatment plan. She thinks she needs a cleaning. She thinks she needs a cleaning. They thought about the treatment options. They thought about the treatment options. He's going to think about the recommendations. He's going to think about the recommendations. She needs to decide on the treatment. She needs to decide on the treatment. They decided to get braces. They decided to get braces. He's going to decide after discussing with the dentist. He's going to decide after discussing with the dentist. She needs to choose a treatment option. She needs to choose a treatment option. They chose the less invasive procedure. They chose the less invasive procedure. He's going to choose the best option for him. He's going to choose the best option for him. She agreed to the treatment plan. She agreed to the treatment plan. They agreed to come back in 6 months. They agreed to come back in 6 months. He's going to agree to the recommended procedure. He's going to agree to the recommended procedure. She accepted the dentist's recommendation. She accepted the dentist's recommendation. They accepted the treatment plan. They accepted the treatment plan. He's going to accept the proposed solution. He's going to accept the proposed solution. She refused the unnecessary treatment. She refused the unnecessary treatment. They refused to have the procedure done. They refused to have the procedure done. He's going to refuse if he doesn't agree. He's going to refuse if he doesn't agree. She needs to remember to brush twice a day. She needs to remember to brush twice a day. They remembered to floss every night. They remembered to floss every night. He's going to remember the dentist's advice. He's going to remember the dentist's advice. She tends to forget to floss. She tends to forget to floss. They forgot about their appointment. They forgot about their appointment. He's going to forget the pain after treatment. He's going to forget the pain after treatment. She's going to learn proper brushing techniques. She's going to learn proper brushing techniques. They learned how to take care of their teeth. They learned how to take care of their teeth. He's going to learn about oral hygiene. He's going to learn about oral hygiene. The hygienist will teach her how to floss. The hygienist will teach her how to floss. They taught him proper brushing techniques. They taught him proper brushing techniques. He's going to teach her about oral care. He's going to teach her about oral care. She needs to practice good oral hygiene. She needs to practice good oral hygiene. They're practicing the brushing technique. They're practicing the brushing technique. He's going to practice flossing daily. He's going to practice flossing daily. She wants to improve her oral health. She wants to improve her oral health. They improved their brushing habits. They improved their brushing habits. He's going to improve his dental hygiene. He's going to improve his dental hygiene. She needs to change her oral care routine. She needs to change her oral care routine. They changed their appointment time. They changed their appointment time. He's going to change his toothbrush. He's going to change his toothbrush. She needs to keep her teeth clean. She needs to keep her teeth clean. They kept their regular appointment schedule. They kept their regular appointment schedule. He's going to keep up with good oral hygiene. He's going to keep up with good oral hygiene. She needs to maintain good oral hygiene. She needs to maintain good oral hygiene. They're maintaining their dental health. They're maintaining their dental health. He's going to maintain regular checkups. He's going to maintain regular checkups. Brushing helps protect teeth from cavities. Brushing helps protect teeth from cavities. They're trying to protect their teeth with fluoride. They're trying to protect their teeth with fluoride. He's going to protect his teeth with proper care. He's going to protect his teeth with proper care. She needs to avoid sugary foods. She needs to avoid sugary foods. They avoided hard foods after the procedure. They avoided hard foods after the procedure. He's going to avoid smoking to protect his teeth. He's going to avoid smoking to protect his teeth. She can't eat hard foods after the procedure. She can't eat hard foods after the procedure. They ate soft foods after the extraction. They ate soft foods after the extraction. He's going to eat carefully to avoid pain. He's going to eat carefully to avoid pain. She can't drink hot liquids after the procedure. She can't drink hot liquids after the procedure. They drank water to rinse their mouth. They drank water to rinse their mouth. He's going to drink through a straw to avoid the area. He's going to drink through a straw to avoid the area. She can speak normally after the procedure. She can speak normally after the procedure. They spoke with the dentist about the treatment. They spoke with the dentist about the treatment. He's going to speak clearly once the numbness wears off. He's going to speak clearly once the numbness wears off. She's going to talk to the dentist about her concerns. She's going to talk to the dentist about her concerns. They talked about the treatment options. They talked about the treatment options. He's going to talk to the hygienist about oral care. He's going to talk to the hygienist about oral care. She needs to listen to the dentist's instructions. She needs to listen to the dentist's instructions. They listened carefully to the explanation. They listened carefully to the explanation. He's going to listen to the recommendations. He's going to listen to the recommendations. She's going to read the information about the procedure. She's going to read the information about the procedure. They read the X-rays together. They read the X-rays together. He's going to read the aftercare instructions. He's going to read the aftercare instructions. The dentist will write down the instructions. The dentist will write down the instructions. They wrote the appointment in their calendar. They wrote the appointment in their calendar. He's going to write notes about the treatment. He's going to write notes about the treatment. She needs to sign the consent form. She needs to sign the consent form. They signed the treatment agreement. They signed the treatment agreement. He's going to sign before the procedure. He's going to sign before the procedure. She needs to fill out the patient form. She needs to fill out the patient form. They filled out the medical history form. They filled out the medical history form. He's going to fill out the paperwork before the appointment. He's going to fill out the paperwork before the appointment. The clinic will provide all necessary information. The clinic will provide all necessary information. They provided excellent dental care. They provided excellent dental care. He's going to provide detailed instructions. He's going to provide detailed instructions. The dentist will offer different treatment options. The dentist will offer different treatment options. They offered to reschedule the appointment. They offered to reschedule the appointment. He's going to offer advice about oral care. He's going to offer advice about oral care. The dentist will suggest the best treatment. The dentist will suggest the best treatment. They suggested coming back in 6 months. They suggested coming back in 6 months. He's going to suggest improving oral hygiene. He's going to suggest improving oral hygiene. She mentioned her tooth sensitivity. She mentioned her tooth sensitivity. They mentioned the pain they were experiencing. They mentioned the pain they were experiencing. He's going to mention any concerns he has. He's going to mention any concerns he has. She's going to discuss the treatment options. She's going to discuss the treatment options. They discussed the cost of the procedure. They discussed the cost of the procedure. He's going to discuss his concerns with the dentist. He's going to discuss his concerns with the dentist. The dentist will inform her about the procedure. The dentist will inform her about the procedure. They informed him about the risks and benefits. They informed him about the risks and benefits. He's going to inform her of all the options. He's going to inform her of all the options. The office will notify her about the appointment. The office will notify her about the appointment. They notified him 24 hours before the appointment. They notified him 24 hours before the appointment. He's going to notify them if he needs to cancel. He's going to notify them if he needs to cancel. The office will remind her about the appointment. The office will remind her about the appointment. They reminded him to brush twice a day. They reminded him to brush twice a day. He's going to remind her about the follow-up visit. He's going to remind her about the follow-up visit.